This conference will now be recorded.
Well, good morning, everybody. Thank you for joining us for this month's Health in the Built Environment Committee meeting. Glad to see so many people joining us and so many familiar faces. Glad to have everybody joining us today. And so I know we have a lot of stuff on the agenda. And we have a special presentation today from Miami-Dade County. So just want to spend just a minute or two reviewing the July 2021 minutes so that we can get those approved and get that stuff out of the way. So I'm not sure if we want to just pull them up for a second or if everybody has had a chance to look at them and anybody will just like to vote.
Do you need a motion to approve?
I do.
Okay, I so moved.
I second that.
Awesome. Well, thank you guys. That was quick. I love that. I love getting that out of the way. So today,
when it says something, we read it.
That's good to know, right? So I'm super happy to be able to introduce Marta Morello today. She is going to be presenting a quick presentation about building efficiency and the public health. And so I also want to acknowledge Jane Gilbert is here joining us. Hi, I'm so glad you're here. Nice to see you. And so I'm going to turn it over to Marta. The Building Efficiency 305 is something that, definitely worthwhile to explore, especially in this committee. So with that, Marta, take it away.
Thank you so much. It's great to be here. I'm really excited to talk to you about several projects that we have ongoing in the Office of Resilience that I believe cross path with public health. And so I'm hoping to speak for about 20 minutes or under if I can, and then we can have some time for Q&A yeah, so without further ado, next slide, please. We can get started. So I will be introducing the office, and then these are the 4 projects that I'm going to talk about. One is the Building Efficiency 305 project. Another one is a SEIA grant that our office is working on along with 4 other counties in South Florida. I'll be talking about the climate action strategy, which is kind of like our latest big plan that we're putting together. And then, as Barbara already acknowledged, our office has hired a chief heat officer, which is Jane Gilbert. And so she'll be talking a little bit about her work and the work of the Climate and Heat Health Task Force. Next slide, please. And just to get us started, this is an overview of the Office of Resilience. It has grown a lot in the last few years, and so we work on the causes of climate change, which is where I sit. So what leads to emissions and how do we reduce greenhouse gas emissions from entering the atmosphere? So anything that is energy efficiency, electrification of transportation, renewable energy, and also the consequences of climate change, such as sea level rise, flooding, and extreme heat. And then we have additional team members who support in this work, such as the communication team that does everything communication with the public, stakeholders, municipalities, and the mayor's office. And then recently, the county also hired a chief Bay officer to take care and protect and restore Biscayne Bay. So this is a little overview. So I sit in the mitigation team, but there are about 15 of us. Next slide, please. And these are really the 3 plans that kind of guide our work. The first one is Resilient 305. which was a collaboration between the Miami-Dade County, City of Miami, and the City of Miami Beach, and looks at resiliency, not just from like an environmental and climate perspective, but also from a financial perspective and public health perspective as well. Next is the sea level rise strategy, which, as the name suggests, provides recommendations on how to accommodate 2 feet of water by 2060. And then last but not least is the climate action strategy, which is what we're working on, and will provide recommendations on how to reduce carbon pollution in our community. Next slide, please. So now I'm gonna get into the 4 projects. So the first one is the Building Efficiency 305 program, which is the program that I manage in the Office of Resilience. Next slide, please. And it was conceived to really tackle energy and water waste in large existing buildings. And large buildings we define as being 20,000 square feet or larger. And they represent over 43% of floor space in the county. And so we thought that by working with this like relatively small number of buildings, we can really have a great impact. And we know that up to 30% of energy is wasted due to inefficient equipment and operations. So that's really the space that we're trying to work in. Next slide, please. And so the benefits of improving building performance in existing buildings are multiple. You know, from reducing energy and water bills to conserving critical resources such as water, improving the comfort level of tenants, improving the productivity, and others, and really using data-driven decision making to take actions to improve building performance. So we wanted this effort to really be based on actual data. Next slide, please. And this is important for, you know, building performance and building efficiency is very important from like a public health perspective, and specifically with relation to indoor air quality. So it's been shown that people perform better in high performing buildings, and really the intersection occurs around ventilation. So while you need, you know, the proper ventilation in a building to, you know, remove, you know, contaminants, you also don't want to overdo it because that leads to inefficiencies and energy waste. And so you really want to strike the right balance. So from an energy perspective, you know, you want to conserve, but then from an indoor air quality perspective, you want to ensure that the moisture is being carried away, that the volatile organic compounds are carried away, and really manage the CO2 concentration in a space. So usually the rule of thumb is that you need about like 20 CFM per person, so cubic feet of air changes per person. That is how much fresh air is needed. And last, I will just say that, you know, if there is no proper ventilation, you know, then there are health consequences. So if the air is too dry, that leads to coughs, asthma, and other respiratory illnesses. If it's like very moist, then it encourages the growth of mites, mold, and mildew, which of course is not desirable. So this is where the intersection happens. Okay, next slide, please. So the B305 program has several components that were developed over time. The program started in 2017. So we started with training, facilitating access to finance, you know, the county leading by example, because of course the county is one of the top property owners in the region. And then we are working on developing a mandatory building performance ordinance. And while that is in legal review, we have started a B305 challenge, which mimics the ordinance. You know, it has like roughly the same components, but it's like a voluntary program. So far it has attracted several buildings, and it's been a great success. Next slide, please. And so I'm going to pause a second here on the challenge, since we started it in February of last year, and so far we've had 59 buildings registering, accounting for 18.5 million square feet. So it's a great success. It's been really great working with all of these leaders, and you can see logos of a few of them that are participating in the picture on the left. What we've done as part of the challenge is we've proposed and led trainings on best management practices around building performance for both energy and water. So we had about 8 trainings. We provided free technical assistance to participants, and we even assigned 3 energy and water audits that were free to the building participants. So it's been a lot of fun, and we are going to measure the impact of the trainings and the audits in the coming months. So we hope to have, by January or February of next year, the results of the first year of the challenge. And I want to mention to you that we, probably late in the fall, we're going to start recruiting for additional buildings to join the challenge. So this might be something that we collaborate on, or if you're aware of building owners and managers and operators of large existing buildings, I'll be happy to provide a self-representation or talk to them, because the more buildings, the better, the greater impact that we can have. And as I mentioned, it's free and voluntary. Next slide, please. And then the second project is the SEIA grant overview. So next slide, please. Miami-Dade County, if you aren't aware, is part of the Southeast Florida Regional Compact for Climate Change, along with 3 other counties in South Florida, so Broward County, Palm Beach County, and Monroe County. And together, the compact has received a grant from the Southeast Energy Alliance to analyze the housing stock of LMI communities and identify energy efficiency actions that will bring the greatest savings to these households. So it's a really exciting project. I think it just started, and so I think we will receive the first results probably next year. But it is really exciting. Next slide, please. Okay, the third project that I want to bring to this group is the climate action strategy. As you heard at the beginning, this is one of the our guiding, will be one of our guiding documents. And so I think it's important that you're aware of it, especially because it kind of brings together a lot of the concepts and principles that I've been discussing in the previous projects, and even expands them to other domains such as transportation, water, and waste. Next slide, please. So I have a few slides here, but I'm gonna rush through them. Please bear with me, and then we'll be happy to dive in more into Q&A. So the reason why we need a climate action strategy, as I mentioned at the beginning, is that what is causing climate change, that is greenhouse gas emissions, are going up. And our office has been doing greenhouse gas inventories for over 30 years, and the trend is clear. They keep increasing, and we really want them to decrease. So we need to take bold actions to bring that line down where it needs to be. Next slide, please. And in Miami-Dade County, most of the emissions come from transportation. That's 55%. Next is buildings and energy, 41%. And then there's like a tiny sliver for water and waste. So really transportation and buildings are the main ones. And this is the 2019 greenhouse gas inventory. So it's pretty recent. Next slide, please. And the climate action strategy supports the recent pledge that the Miami-Dade mayor did in last April to be part of the Race to Zero, which brings a commitment of reducing greenhouse gas emissions by 50% from 2019 levels by 2030, and with a long-term goal of becoming net zero by 2050. So these are really, really ambitious targets. And before that, the commitment for the county was to reduce greenhouse gas emissions by 80% by 2050. So as you can see, this is a really big jump. Next slide, please. And this is where the climate action strategy currently stands. So, you know, our target is the green block that you see there. The yellow represents the climate action strategy implementation. And then the red line at the very top is business as usual. So if we didn't have a climate action strategy, our emissions would keep going up. With the strategy, they are going down, not quite reaching the target. We're aware that there's a gap that we need to fill. So we're working with our departments to find additional actions that can get us to the target. And you know, you can see the long-term goal of net zero by 2050. So again, this is really ambitious. This is going to take a lot of work, not just on the side of the county, because we're not in this alone, but everyone in the community. Next slide, please. And this is the timeline of the strategy. So it was released, the draft was released in April of 2021. We spent the summer doing community engagement and gathering feedback. And now we're reviewing the draft, and the final release will occur in the fall. I apologize, this is an old slide. It says September, but it's been moved to the fall. The goal is really to have it ready by November, which is when the COP26 occurs in Glasgow. Next slide, please. These are the three main areas of work for the strategies, which reflect, again, like where the emissions come from. So in the next slide, I will be outlining some of the actions that the strategy foresee. Next slide, please. So for energy and buildings, which is the first bucket, there are three approaches, and the first one focuses on existing buildings. So benchmark, you know, which means track energy and water consumption, and retrofit existing buildings, because that's most of the building stock in the county. The second approach is to expand renewable energy generation on buildings. So install solar, whether it's floating solar, ground mounted, or rooftop solar. And the last one is build ultra low energy buildings, because the buildings that are built today will have a lifespan of decades. And so they need to be ultra low energy today. For the land use and transportation, the first approach is to reduce transportation-related fuel emissions, which means electrifications, reducing vehicles' miles traveled, and basically diverting folks from taking the car to other modes of transportation. And so the implementation of the SMART plans would fall under this approach, and that's ongoing. And then the second approach is to expand and protect green and blue spaces. That means Biscayne Bay and whatever other tree canopy and parks and other green spaces that are found in the urban landscape. And then last but not least, We have the water and waste categories, because even though it's like a small sliver, you know, we still need to take action on that. The first approach is to convert waste to energy. And the second one is to reduce waste and water use. Decreased waste leads to decreased waste in landfills and increasing diversions away from landfills. And reducing water use, besides protecting water, also reduces energy consumption, because it takes a lot of energy to move water around, you know, from the end users to the wastewater treatment plants. So next slide, please. Okay, so that was an overview of the climate action strategy. I know it was a lot of information, I apologize. And now I'm gonna leave Jane Gilbert to bring this home with her work as Chief Heat Officer and the Climate and Heat Health Task Force. Jane?
Great, thank you. So it's great to speak to each of you this morning and give you an update. So first, I just want to say why the county and Resilient 305 to hire a chief heat officer. You know, we've been known nationally, internationally, for our risks to hurricanes and to sea level rise, and the county has been working for a long time to really build our very strong emergency preparedness and response procedures on hurricanes, and to put together a very robust sea level rise strategy, as Marta described earlier, and investments in our public infrastructure as well as our building codes, et cetera, to address those risks. Heat has been a growing concern amongst our particularly low to moderate income populations across the county. It is a slow growing risk that we now experience about 133 days a year at a temperature of 90 degrees or more, and with an average summertime humidity of 65 to 70%, that equates to at least a heat index, or feels like temperature, of 103 or more. That's at a level where really any person is at risk if they're out and exposed to that heat index for a significant period of time, but it's particularly of concern to those that have less choices about that, like outdoor workers, people who can't afford the air conditioning, increased air conditioning costs with this increased heat, with people having to take bus, transit in areas, public right-of-ways that are very exposed. And there are certain populations that have a harder time regulating the impacts of heat, those being elderly, pregnant women, young children, people with pre-existing conditions, particularly lung and heart conditions, and people on certain medications. And so there was a real need to, like we've done with our sea level rise strategy, to create a integrated plan addressing, integrated with the county's work on carbon mitigation that Marta just described, and our sea level rise, to address this increasing risk, not only across departments within the county, but with our partners at the health department, with multiple agencies, National Weather Service, our university partners, and our community-based organizations. So my role is actually situated through the Resilient 305 partnership, and we'll be putting together an interdisciplinary task force that will come up with, I'm looking at a very short-term action plan, and then a vehicle for addressing future priorities as they go. And those will be in the areas of increasing public and employer education around the risks of heat and what people can do to avoid heat-related illnesses. And secondly, how do we build the capacity of our emergency management personnel and facilities, as well as our healthcare personnel to address these increasing risks. Third, and this is very related to what Marta shared with their energy efficiency work with low income, how do we really elevate and increase the accessibility of affordable, efficient air conditioning for our most vulnerable populations through expanded weatherization programs, energy efficiency programs, et cetera. And then finally, in the long term, how do we address the urban heat island through tree planting, cool pavements, and increased landscaping, things that will not only address our urban heat island, and we have data from our university partners that is showing that our urban heat islands can be as much as 15 degrees Fahrenheit hotter than other areas. And through these mitigative factors of tree planting and cool pavements and more green landscaping, permeable pavements, et cetera, we can significantly reduce that extra heat island that can really not only save lives, but make it more accessible for people to walk, bike, and work in our public spaces. So we're in the process of figuring out exactly how to put that task force together, and we'll be launching that later this year, probably in November. But I welcome questions and input. And we recently worked with the Department of Health on a joint application to the CDC Building Resilience Against Climate Effects program. Valerie was involved with that, and they were a partner. We were recommended for funding, but didn't actually score quite high enough. It was very competitive. Only really state agencies and county public health agencies won that award. We just got notice that they are holding on to our application in case there's the current Biden administration's recommendation for increased funding gets through with the budget proposal, and we may still get funded. But regardless, that really helped us lay the groundwork for how we're going to work together in our plans, and we are looking at other funding sources to support it.
Thank you, Jane. And I just want to say thank you. On the screen, we see our contact information to reach out to us or in general to the Office of Resilience. And feel free to register for the newsletter, which comes out once a month, and it's packed with cool information. And thank you. I think we're a little bit over time, but thank you so much for having us, and happy to answer any question.
You guys are just perfect. And in fact, I think we actually have a few minutes to open the floor up for any questions that anybody that is joining us today might have. And if you guys want to unmute yourself and have any questions regarding the presentation we just heard.
Well, I have a quick question. And I think there are like two challenges. One is given the incredible loads of buildings, a lot of it's coming from mechanical systems. So understanding the heat load and understanding the emissions, is there a kind of, and also we've been in conversations with people who feel that, yes, we need to provide expanded air conditioning to be able to deal with this. So is there any kind of initiative on how there's a South Florida approach to this idea that the issue of heat is of an incredible magnitude? It's probably maybe our greatest climate-related public health crisis. I don't know if it's fair to say that. Jane, you could correct me if not.
It is nationwide for sure, and I think one of the challenges we have is getting good data, and that will be one of the things I will be working on, because the heat-related illnesses and deaths are not well documented here.
Right.
So I can't say it definitively in South Florida, but it's certainly indications are that it's quite high, and certainly the feedback we get from residents in particularly our low-income communities, that's their top concern.
Yeah. So is there a kind of initiative to look at how to provide the kind of mechanically cooled spaces that are actually needed to deal with, because there's only a certain, I guess, there's only a certain amount that you can do when the heat and humidity reach a certain level, and all of the kind of tricks of the trade, the shade and the ventilation and increasing airflow, there's just that physics that you need to deal with artificially. So I guess what I'm asking is there an initiative to look at some innovative ways to doing that do not add to our emissions? Is that kind of like a task force unto itself that brings together the point that the situation that Marta just described and where Jane's going?
Well, I think it aligns very much with the climate action strategy goals of, first, let's focus on building efficiency and getting better AC units. Right now, our older AC units are also emitting chlorofluorocarbons, which are greenhouse gases and pretty significant ones. So if we can improve our building envelopes and improve the efficiency of the AC systems and lighting systems within those buildings, then you're, one, reducing the cost, the burden, the utility burden for people, and you're reducing your overall emissions. And then we need to work on the emissions of our utility grid, right? Those are really, those are the best ways to do that. There may be other cooling technology that's out there that won't use our electricity, and certainly that is something, but I think that's out of the scope of what the county can do. That we need to invest in that, but I do think that what's within the scope of what we can do regionally is absolutely have aggressive plans on energy efficiency and working on cleaning our grid.
And the as Jane mentioned, energy efficiency is the first line of defense, really. And the second approach, as we outlined in the climate action strategy, is to increase generation of clean electricity via renewable energy. In South Florida, it's mostly solar, because at that point you don't have emissions associated with that energy consumption anymore. And so really, it's the power that comes from that combination. Because the more efficient your house is, the fewer panels you need to produce the energy. And so that's really where we're going. And as in the strategy, there is, I failed to mention this, but in my presentation, but we want to really look at equity and ensure that the first ones to benefit from these programs are LMI communities. And so there is like a big emphasis on the weatherization program and other ways to weatherize households, for low-income communities. And so the county has been working in that space for years, with the weatherization program, and we're also looking to bring to the county the SELF program. It's a financing mechanism. It's a solar energy loan fund, which has been extremely successful in other places. So while, as Jane mentioned, like what the county controls and is limited, we very much want to work with our partners, in the private sector, the financing, the utilities, who can do great impact.
Thank you, Marta, and thank you, Jane, for the presentation. Their information is on your screen. If we didn't get to somebody's questions, I know time, this hour just goes by so fast all the time. And so you, Marta and Jane, you guys are welcome to stay on and listen to some of the other things that we have on the agenda. But again, thank you so much for this presentation, and I'm sure we'll ask you back for some updates as these projects come into fruition and to see the status and how we can help. So
Thank you.
moving,
We actually very much want to circle back as we get further along in our planning with this committee.
perfect. Yes, thank you, Jane.
Thank you.
So moving on to our next piece on the agenda is just a quick executive board update. So for those of you that haven't received all of the emails about the consortium annual event and award ceremony, this is a reminder that it will be held virtually on Friday, October 1st, and that the theme this year will be Fall into Healthy Habits. There will be a $25 registration fee. And as a reminder, this event will be combined with the Worksite Wellness Awards. There is also ad sponsorship opportunities for the ceremony booklet. So just if you haven't gotten the emails, I know Candice is putting it on the chat right now, so you don't forget to register. Then Candice also presented the results of the subject matter expert conversation to the board meeting in June. The results highlighted findings from the conversation and compared to the 2013 evaluation. This was conducted to review the sustainability and provide a more current evaluation of the executive board. The board is also continuing the discussion on COVID-19 vaccinations and supporting the HFSF I Did It campaign. So I know that we've sent out information about that before, but I'm sure on follow-up emails you will receive more. The board has had a brief health equity discussion to think about how we can raise awareness and understanding of health equity issues and how the social determinants of health play a role within our community. So you'll be hearing a little bit more about those discussions in the upcoming meetings. DOH provided grant updates. The RFPs will be for media efforts. So the RFAs will be related to all areas of the social determinants of health. This will be based off underserved areas and communities with high rates of chronic disease, as well as the level of impact by COVID-19. More details will be shared as applications become available. Our next item is previous action updates. And so we do have a little bit of an update on that. So in the last couple of meetings, we've been talking about committee work group selection survey, just to be able to kind of break up into smaller groups to have some action items for this committee. We left the survey open from our May meeting, and we currently have received 9 responses. So if you have not had a chance to fill out the survey, we will put it in the chat if we can, to see if, as people are looking at these groups, maybe we have a pretty good group here. If you are not one of the 9 that have filled out the survey, please do so. So as a friendly reminder, like I mentioned, you can still complete the survey, and then the survey link, we can put it on the chat as well. So what we have here so far, there is a lot of interest in community gardens. That was a project that we talked about in developing a community gardens map of Miami-Dade County, and collaboration. I know that work is being done. We just had again, the executive board just had a meeting yesterday, and there was some updates on the community gardens and the collaboration with the Worksite Wellness Committee. So now our next step for that group will probably be to meet and connect with the Worksite Wellness Committee for this project. The other groups that we have is the communication group to help us really put more media posts and newsletters and share and try to re-engage our past members. We have quite a few people that are registered for this committee, but we'd love to get more and obviously invite new partners to the committee to continue our work. And I think there's one more slide on this, right? So there were some additional recommendations through the survey that we asked all the committee members to see, besides those 3 projects, what other projects would be something that this committee can take on. So you can see on your screen, we have equitable weatherization, active design, Miami updates, limiting illegal dumping effects, age-friendly communities, public spaces and private properties. So some of these we can probably try to join with some of the previous ones here, like Healthy Little Havana involvement in Jose Marti Park, and see how that fits into a group that we can create a working group from. So this is just a quick show of the selection survey and what we are now going to put into action. And now we want to move on to our partner updates. Our next committee meeting will be on Tuesday, November 9th at 10 a.m. And so we did receive an update from Urban Health Partners, and I think they're also here, but I'm just going to quickly share, and maybe they can expand on what we have here as an update for them, is that they're partnering with Miami-Dade County on a new project that seeks to engage residents in the process of testing out new innovative mobility solutions. They think it is crucial that the county's plan to bring in new transit and mobility solutions incorporate the perspective and needs of older adults. So there are 2 opportunities for residents and other stakeholders. One is the recruiting community liaisons to become part of the project team. This is a compensated opportunity for residents of the target communities within the project to support outreach and advocacy efforts, help co-design the direction of the project and inform the county's plans, and participate in capacity building opportunities. There will be a registration. We'll drop in the link if you are interested or know anybody that is interested. There's also a need to participate. They're looking for people to participate in interviews or digital diaries. And this is also a compensated opportunity for individuals to participate in in-depth interviews or complete digital diaries regarding their unique experiences, needs, and priorities with mobility.
Barbara, I just wanted to interject really
please.
quickly that we actually have completed I'm sorry. Hello, my name is Tiffany Bratcher. Didn't even say who I was. I'm recently joining UHP since the beginning of May as their outreach and training coordinator. But we are bringing on a new project, the new Miami-Dade County New Mobility Project that Barbara was just mentioning. But we have completed the process for the diaries and I forget the other one, but we're mainly focusing on the SEIA recruitment, as we are diehard trying to find community liaisons, primarily in the areas of where we still need Sweetwater, Hialeah, Homestead, and Aventura. So those are the areas that we're primarily focused on in trying to identify community liaisons for this new project. We are trying to start at the very end of this month as the onboarding process and go from there. This is an exciting project and opportunity that UHP has to work with Miami-Dade County, the Knight Foundation. As again, this is new to me, but overall it's exciting to know about these new projects coming down the pipeline for new mobility solutions. So if you all can keep your eye out, we would definitely appreciate anyone that you can refer over as community liaison. It is $15 an hour, up to 25 hours a month. The project is set to go towards this time next year-ish. Maybe there'll be an expansion, maybe not. But yes, anything that you can forward on that would be greatly appreciated.
Great, thank you, Tiffany.
You're welcome.
And so I'm going to open up the floor to our other members, and if anybody would like to share some of the projects that they're working on for our updates.
Hey Barbara, this is Danny from Motion Conservancy. Some updates. So we're going to be working on a community organizing and engagement portion for the circularity assessment protocol from Motion Conservancy. So that's like a waste management study that was carried out in the city of Miami. I think I've shared a few times about the project, but the next phases are going to be really having like events throughout the different commission districts within the city of Miami so that we can get folks to to talk about it, but more importantly, to help us look through the report and co-create an action guide that can then be used for a on-the-ground advocacy campaign come springtime, and that will be coupled with some work at the Department of Public Works and Resilience. And hopefully by then we would have a separate Department of Resilience, which seems to be in the budget, which is exciting. The other thing I was going to mention for date implications, I don't know if anyone has been following the Hold the Line committee emails or the whole movement on expanding the urban development zone. And so there's a project that's happening. So in South Dade, around the Homestead area, where there's a logistics center that's trying to be built. The county commission passed in first reading, and so there will be a second opportunity sometime later. But what I was thinking of the implications on that, I'm kind of I'm not an optimist, so I don't think that the kind of environmental considerations are going to win out. Let's just kind of put that out there. But I think that the proposal can probably be pushed to be more in line with some of the public health concerns that I think a big project like that could bring to the community. And I also support the kind of the push to provide more work and more employment opportunities to South Dade, so which I think are great. But I think a lot of that can be done through a really interesting built project that will bridge that gap between the environmental considerations, but also bringing more of that kind of the community center design aspects that will have a resilience center incorporated or something that's just going to be a little bit more of a benefit to the community rather than just here's a new center where you can apply to jobs that businesses are going to open up. Those are my thoughts.
So Danny, what are the next steps on that? Or is there a committee that you said is being put together for proposal, or what are the next steps?
And if I wanted to let Danny know real quick that both myself, Kimberly Brown, and Adrian Burke are on from Miami-Dade County Planning. So Danny, if you want us to provide any information, we'd be happy to.
Yeah, and maybe you can correct me if I'm wrong, but there's a second reading by the commission sometime, I think, later this month or maybe October, because it needs to go up to the state to determine if that's if it's a feasible thing to expand the urban development zone, and then after that it comes back to the county commission. Is that correct, Kimberly?
That's correct. Yeah. So the hearing that Danny mentioned was a hearing before our Board of County Commissioners to transmit the application to the state. It'll have a 30-day review there and then return for final action by our Board of County Commissioners. So that would probably happen sometime in November. Adrian, is that how you're tracking it as well? Sometime in November?
Hopefully you all can hear me. Yes, we don't have a date certain though, so I'll put my contact info in the chat and feel free to reach out to me for updates.
Gotcha. And then I guess
Great.
out of curiosity, since we have a planning team, have those conversations of providing more of a community benefit or a social benefit, has that avenue been pursued by you guys? Are you thinking okay, if we're going to see this come through, we're not the county commission's not going to really listen to the recommendations from the long range planning team, how can we extract more benefit? Has that been part of the kind of the calculation?
So not as a specific recommendation from staff, because our recommendation was to deny and do not transmit the application. That is something that came up at the county commission meeting, was something like a community benefits agreement, and the applicant expressed being amenable to that, but that's not anything we've seen or had specific conversations about. There is a development agreement that is moving along with the zoning applications for this. That might be another opportunity to put in something, but we haven't specifically seen any proposed language or anything from the applicant, and we haven't put forward anything yet.
Gotcha. And I guess last question, and sorry to kind of derail us down this path, but are we I guess not, I'm not part of your team, but since you recommended to deny the application, are you still hoping to do that right now when it comes back to the Board of County Commissioners, or change of strategies? What's the play?
So that's a great question. You know, we're partially waiting to see what the state says. And also it's going to be a matter of timing, how much time we have between the state returning their comments and when that next meeting gets scheduled. So it's not uncommon for staff to issue a second and final report before a final action hearing. We just don't know yet if we're going to have time to do it, but to the extent staff is, I mean, we're still very much engaged in the discussions, so that's all still kind of up in the air, to be honest with you.
And I see,
Gotcha.
Adrian, that you put your contact information in the chat if anybody has any other follow-up questions.
I was just going to say, yeah, very quickly, I'm the application manager for that application. So if anyone has any questions about it or just wants to know more about it, please feel free to reach out to me.
Great, thank you. Any other updates? Joanna, Anna Marie, I see you're on. Camila?
Well, actually, Barbara, I just wanted to clarify. I mean, I understand the discussion of a political strategy, but just to be clear about the fact that anyone who's looking at it from a point of view of land, science, and health, water supply, is saying we should not be building in that location. So I just want to, I mean, that's kind of the baseline, right? If we were just following fundamentals about water and climate and population and health, we wouldn't be building there, right? Danny's like, yeah, absolutely. Okay, I just want to make sure that's where we are. I mean, I understand there's this political world. I just want to be clear about public health aspects.
Anna Marie or Camila, any other partner updates?
Hi, good morning, everyone. I'm Anna Marie de Mello with Urban Health Solutions and co-founder of Urban Health Partnerships. Happy birthday, Urban Health Partnerships. Tiffany, I know you guys are 10 years old today, so happy birthday. Quick question. Is this group looking at the Integrated Transport Health Impact Model, the ITHM? Have you all been looking at that? From looking at for the integration of health and transportation?
No, we have not. So far, we kind of have been trying to go through some presentations and getting those subcommittees, but that's something that definitely we should put on the agenda and have a longer discussion. And so, Anna Marie, would you be able to send us, or Candice, do you guys already have something that we can use for our next committee meeting?
I am not aware, so definitely we'll follow up.
And it doesn't have to be next. I was just wondering, I added it to the survey as one of the topics, and I believe FDOT had retained FIU's Metropolitan Center to do a study on how to best look at health and integration with transportation and looking at the metrics. And just because health in the built environment and looking at transportation from a health lens has become more and more popular over the last 10 to 15 years, but some of the standardized metrics that we're using in the US and abroad are still up in the air. And so there's been several health impact assessments throughout Europe and the US, and the data typically comes from the health departments. And it looks at traffic injuries, air pollution, and physical activity. And then, you know, the recommendations as an NEHIA are also integrated, and there's a large emphasis on climate and equity and physical and mental health. And I thought that maybe just hearing today's presentation and looking at some of the topics that came up of interest, that might be of interest for us.
I think that's a great thing for us to really look a little bit deeper into. And thank you, Anna Marie, for sharing. And if you have any of those reports that you can share with us to make sure that we cover them and we integrate them maybe into the subcommittees, that would be really helpful.
Sure. And Urban Health Solutions is conducting a health impact assessment for the TPA, for the Transportation Agency in Palm Beach on the Okeechobee Boulevard in State Road 7. And they're using the steering committee had selected to use the IFA model. So I can also pull the report and share where they are in the process and any resources that might be of help to us.
Great, thank you. Thank you so much. And it is 11 o'clock. Wow, time flies. I know we didn't get to everybody's update. So if there's something you'd like to share with this committee, please send it to Mia or Candice so we can make sure to send in the follow-up email. And I just want to thank everybody for joining us today, and just expect some more emails from us. And for those of you who filled out the survey and have signed up for maybe some of those subcommittees, you will be hearing from us sooner so we can start those meetings. Is there anything else, Candice or Tamia, that I missed?
I think that sums it up. If there's any other updates, please send them to us and we'll make sure to include them in the email. So we all hope you have a great day.
Thank you, everybody.
Bye, Barbara.